Yeah.
Yeah. Okay. All right. Hey guys, here. So I want to introduce my sister, Jessica Fry. She is on here, and she is actually going to help me out because it is hard to do a PowerPoint and interact, but also follow the chat and let people in. And I want to make sure that I can really focus on the cases and explaining stuff to you. So that is her, just so you're not wondering who is the person that I am asking questions or who keeps interrupting me. So if you have questions as we go along, make sure you're muted, but you can drop questions in the chat. I'll try to hit on the ones that I can, but I also want to get through everything today. We are going to try to focus on kind of communication, and I will tell you that communication is one of my strengths. I feel like I get great compliance from clients. Not every client is going to love you, and you will not get along great with every client, but I do feel like a majority I really vibe well with, and I get a lot who will love diagnostics and the treatments that I want to do. I think a lot of it comes down to your communication. We're going to go over some of that and go over some communication pluses and minuses. Okay, so can everyone see my screen? I hope so. Goals of this class. I just want to reiterate this every time because I think it's really, really important. This is a silly picture on the front page because it is not all about getting everything right and correct all the time. This is about learning, interacting, and I need you to interact with me for this to go well. So please make sure that you're answering questions, even if you're not 100%, or if you have questions that you're asking. I think that's going to be really important for it to be successful, okay? Now we're focused on communication today, and we're going to do case-based because I think I can tell you a lot about what you should think about, but I think really when you think about, okay, a specific case, how would I portray this to the owner? What are going to be the questions they're going to ask? I think it helps you a little bit more in developing your communication skills. And everyone is going to have a different way of communicating. So I'm going to tell you what works for me, but I will tell you out of there's 3 of us in our practice, and I am probably the most straightforward. I really just tell people what we're dealing with. I like to explain things. I let them be a big part of the process. And so the way I communicate is pretty straightforward. One of the vets I work with is probably more of a sugarcoater, and he's not quite as direct, which is fine. And he has some clients that love him for that. And then the other one is probably direct sometimes, and he will sometimes be more straightforward than I would even be. So then someone else around you, do not try to communicate like other people. You need to find what works for you and what you're comfortable with. And you'll have some clients that love it. You'll have some clients that maybe don't. But the good thing is there's lots of different veterinarians out there and lots of different clients. So you will still find your people, okay? So case-based discussion, general practitioner knowledge. So I am a general practitioner. I also work in the ER, but most of this is going to be just based on small animal general practice knowledge. We're not going to get into pathways of endocrine systems and things like that. It is going to be the basics of how I work things, how I handle them, and how these specific real life cases went. These are all cases that I've had in the past couple weeks. And so it's not going to be anything too crazy or in depth, okay? Again, fun, interactive, and informative. So I need you guys to participate, please. And then also, this is my way of handling these. You might hear other stuff in school. You might do externships, and this is why you should do externships in shadow, because there's more than one way to approach a lot of these things. And these are the ways that work for me, but there are ways you can handle things can be different. So we'll walk through these and see what we come up with. So I think this is really important. I think that one of the main things with communication, and it sounds weird because you think about, I need to learn how to communicate with clients, but really a big, big part of that is listening to your clients, because your patients can't tell you the history, and you really need to get the history from your owners. And there is a lot they can tell you with time frame. If the pet is vomiting, are they vomiting food? Are they vomiting bile? Have they vomited once? Have they vomited 5 times in the past 3 days? Once 3 days ago, eaten lots of meals since then, and then vomited again. That history is vital sometimes in telling you how aggressive you need to be and what you need to be thinking about for potential differentials. So listen to your clients. It is so, so, so important. Body language is really important too. if you have a client who is not really engaged with you when you're talking about what's wrong with their pet, sometimes that's already a sign to me that it might be tricky to get them to go along with my diagnostics and with my recommendations. And what I do with those people is I don't give up. I don't say I'm not going to care. They're not going to want to help their pets. Instead, what I say is I need to find a way to connect with this person. I need to find a way that they understand that I care about their pet as much as they do, and I'm here to help them. I'm not here to judge them with any of the decisions they're going to make. So reading their body language is going to be really, really important. If you have it's like holding Fluffy and you can barely get Fluffy away to get an exam on Fluffy, she is more than likely very, very concerned and is going to want your recommendations and be more likely to follow them. If you basically sets their dog down, I don't know how long it's been going on. And they're not really engaged and don't care, it is harder sometimes to get those people involved in the conversation. And emotional status. So again, what that means is, are we distraught? Are we upset? Sometimes people can be too emotional and it is hard to get through to them, and you need to give them time to digest stuff longer, and you need to give them time to take a breath. And sometimes people are checked out completely, and sometimes people are perfectly upset, which is normal in the circumstance they're having, but you need to kind of be able to assess and feel out those things and see how you're going to approach them. The other thing is, and people don't like this, but as a veterinarian, you are a salesman, okay? That does not mean that you're trying to always make the most money that you can. What it means is you are trying to show the clients the value of what you're recommending, okay? Not the cost of it, but the value of it. So it's not, this blood work is going to be $200. It's going to be, we need to do this lab work because we really need to differentiate if this is like pancreatitis hospitalized, or if maybe it's just GI upset, which we can maybe treat outpatient and it's less serious and we can get your pet home with you. So I do think that showing value is important, and that will increase your approval and compliance if you can show them why you're doing what you're doing and not just what you're wanting to do. So saying we are taking x-rays because we want to rule out A, B, or C, or we want to do the blood work because the longer we wait, if this is what I think it is, the more serious it becomes, the more expensive it becomes to try to treat, and potentially we can't save the pet. So I don't really lead with cost of things. I lead with what I want to do, why I'm doing it, and then I follow up with it would be about this much. And I think it's important in how you do that. If you throw at somebody, we want to do blood work and x-rays, it's going to be $500. This is why. I think you lose them at the $500. I think that if you start with what you're doing and why before you get to the cost, it can make a big, big difference. Give them time. If someone's really emotional, I hate it when people feel uncertain and stressed. And I will always say, why don't you take some time? Do you want to call your spouse? Do you want to have a couple minutes? And I'll come back in, especially if we're dealing with something like a potential euthanasia. I never rush those decisions, ever, because even though it is painful sometimes to get behind on appointments or to have them take up a room for an extra 20 minutes, it is well worth it in the long run for them to be ongoing. You see all the time those reviews online where people say, you know, the vet really didn't care and they rushed me into a decision and I put Fluffy down and I didn't want to. That is because they didn't have time to process it. It was still the right decision probably for the pet and for the owner, but if they don't really have time to process it and take it in, then sometimes that can turn out bad for you. So letting people have time to breathe, to consider things is huge, giving and just really working through the options, because there's always options, okay? There's not ever just one way to do things, and you need to be comfortable with saying, okay, this is what we can do. This would be my recommendation. If financially you can't do that, here's another option. You need to kind of have your plan A, B, C, and D in your back pocket. And you'll get those really commonly for really specific things that you'll kind of learn what works and what doesn't and what to prioritize. Advocate for the patient. So I will actually use this term, and I think it would be a good one for you students to kind of keep in the back of your mind. I will say to an owner, especially if a pet is in really bad condition, owners financially cannot do more, I will say, you know, I know this is really hard, but my job is to advocate for your pet because they can't speak for themselves. And I can tell you that with the heart rate that I'm getting, with the condition that they're in, with the level of anemia that they have, this is really uncomfortable, really painful. And as much as I don't want to say this, I do think your pet is suffering and it is time to consider euthanasia. And what it does is, by saying I'm advocating for your pet, it is them realizing that you are not judging them, you are not telling them what to do, you are coming from a place of, I care for your pet, I'm trying to do what's best for them. They can't speak for themselves, so I am speaking for them. With chronic conditions like diabetes or kidney disease, especially when you can kind of say, well, obviously they can't tell us how they're feeling, but in people, when you have toxins building up because your kidneys are failing, it makes you really uncomfortable, it makes you really out of it. And, you know, I just want to explain to you how I feel like your pet is feeling and how they're doing. That makes a big difference than saying, yeah, your pet's kidney failure and you need to do 3 days of hospitalization or it's going to suffer and it's going to die. You have to somehow explain to them why it is important. And I think the term advocating for your pet, to me, has been really, really successful when I am dealing with clients and they're uncertain. And it sometimes will just kind of help them have that like light bulb moment and realize what they need to do. So this is a book that I highly, highly recommend. And it sounds weird, this book has been around for years and years. And it is all about body language. It is about how when you're having a conversation with somebody, there are things that you can do to increase compliance, basically to sell them on an idea, to have them be a part of the process. It is very tangible things that you can do, skill sets that you can develop. And I have read this book over and over, and every time I read it, I get something new out of it. I'm excited because there's an In the Digital Age one now, and I have not read that one yet, and I really want to. And so I do think that that would be a great book for everyone to get a hold of, and it has a lot of valuable, tangible things that you can practice and you can use. Especially right now, we're in a pandemic, looking for things to do. Buy this book, read it. I promise you it'll be well worth it. So, case time. Remember, this is time to learn, this is time to ask questions. My sister Jessica Fry is on here. She's going to be looking at the chat. She's going to let me know if there are questions that I need to address coming up frequently. I'm also going to ask some questions on here just to see what you guys are thinking. And so I definitely want to hear what your thoughts are while we're going through this. And then we'll see what we come up with. Okay, so case number one. It's a 2-year-old male neutered German Shepherd mix. Okay, he was super cute. He has been vomiting bile and food, started with food, now bile. He's vomited 3 times in the past 12 hours, so pretty much overnight. He's has a decreased appetite, he's lethargic. And this is a new pet to these owners. So they rescued this dog 2 days ago. So they've had it for 2 days. On exam, heart rate was okay, mucous membrane, CRT, everything okay, just mild abdominal pain on palpation, okay? So nothing dramatic. He is current on vaccines and preventions per the rescue, and this owner has financial constraints. I actually have this owner's other dog that is my patient, and this is their new pet. So I have a couple questions. One would be, what are your first thoughts? Okay. Oh, sorry. Please show the book again. I'm glad somebody wrote it. So one question would be, what are your first thoughts and what are the questions you have for this owner? What are you going to ask them? And what is one of the big things that you need to realize that is a limiting factor with this pet that makes it much harder to diagnose? It is not the finances. That is a clue. But I want to know what you're thinking about. So you guys are coming through on diet change, yes, since it's a new dog, definitely that is on, and limited history. That is probably one of the biggest ones. And I will tell you also, if they are a rescue, I'm always kind of like, were they vaccinated? Were they not? A lot of people were saying foreign body is definitely on the list. And I asked this client 5 different ways if this pet could have eaten anything. And I will tell you, with foreign body questions, do not just say, has your pet eaten anything? You can't make it that direct, okay? You can say that, but then I also 2 minutes later will say, well, are there poison from the house? Has there been anything torn up in the house? Hey, has he gotten into the trash can? So the foreign body ingestion question is something that you definitely have to present a couple different ways. This owner, over and over emphatic, this dog has not eaten anything. It's only eating dog food since it's been with us. There's no way it could have a foreign body. They even contacted the foster. There's no way, there's no way, there's no way. Okay, so the next thing is, if we have financial constraints, this is history, is the one test you're going to recommend, okay, with limited finances. That is the next thing I want to know. This is live. One test. Awesome. Yay. So many people are coming through with the correct answer. X-rays. Okay, let me explain to you why X-ray is going to be my #1 thing. One, because if this is a foreign body, you need to know. You need to make sure you don't treat this thing medically for a really bad foreign body, because you could end up with a pet that has a ruptured gastrointestinal tract, okay? And these people have only had this pet for 2 days. And I'll tell you, even owners that have had their pets forever and ever and ever, I still will often take an X-ray. Ooh, GDV, that's another good reason to take an X-ray. I will still often take an X-ray because ruling out a foreign body, which is a surgical issue, versus something like EPI, pancreatitis, gastritis, which are medical issues, is a huge differentiation. And this is a very easy conversation to have with an owner. Nicole just asked, how in the heck do you have this conversation if they say that it's not a foreign body for sure? This is what I tell them. I don't scare them, but I'm very, again, straightforward. And I say, the problem is, if this is a foreign body, because you've only had this dog for 2 days and we missed it and we treat him with things to get him to stop vomiting, he could rupture his stomach and he could die. So I am that straightforward in saying, the problem is, if we miss this, it could result in your pet dying. And that is not a lie. And so it's something I'm comfortable saying. And the other thing is, it is something that most owners are very receptive to. I've had some that say, nope, there's still no way that it's a foreign body. They decline the x-rays. That is fine, okay? All you can do is make the recommendation, but I 100% am gonna be saying, we gotta take an x-ray, okay? Because if you don't offer it because you're worried about finances, and there is a foreign body in there, you're in a lot of trouble. I also say, the big issue is this a surgical or medical problem, okay? Because if it's surgical, you have to go to surgery. If it's medical, you have to try to do medical management. But those are two completely different things and completely different pathways. So you guys are right on the money with, we took an x-ray and we did, I promise, for some reason. Oh, there we go. Okay, so this is my x-ray. This is my lateral. I didn't put the video up just because there's not a ton of room on here, but this is a dog that has been vomiting over and over and over for 12 hours. And so I want to know there's two really main things that stick out to me with this x-ray, but there's one that really sticks out to me. What are the things that stick out to you when you look at this x-ray? Yes, that stomach is full. Okay, and there are some owners that come in and say they vomited once, and they might still have a stomach. Always ask the last time they ate, because people will lie and they'll say they've been vomiting for 3 days. Oh, but they ate this morning. These people are like, this dog has not eaten for a day and a half, and it has been vomiting and vomiting and vomiting. This stomach is way too full for that. Okay, this is a huge red flag, huge, huge, huge. There is gas in the small intestine for sure, but the stomach is the biggest thing that made me really uncomfortable. And so, again, these financial constraints, how do you approach this? I was as straightforward as possible. There is still food in the stomach. When you've been vomiting, you should have nothing in your stomach. I'm really concerned that what's in the stomach is not food, and it is actually a foreign body. I really, really, really am concerned this might be a surgical issue. However, you have financial constraints. So here's our options. The options are, we go straight to surgery, and we might have a negative exploratory. I've had many negative exploratories, that is fine. You have to get used to that. You have to get comfortable with that, okay? Or what else can we do for this pet if we want to know for sure if we need to take it to surgery? It was not currently vomiting and it was only mildly painful on palpation. So what is the other options that we can do and recommend? By the way, you guys are doing awesome and hope this is helpful. Abdominal ultrasound is one. I'm seeing barium, scope, fast and repeat rads, scope, barium. These are all good answers. A couple notes real quick. Number one, endoscopy is amazing and great. I do not pursue endoscopy unless I know for sure it's something that I can grab.
Well, I had to get the first dress.
Difficult to remove stuff with the scope depending on what it is, and especially if it is a large like cloth material, sometimes that can be really tricky to grab and get it all the way out. So I do like scoping for small things like balls, or dogs have eaten bones recently. Scoping a beach, especially with the gas that's also in the small intestine, I would want to explore this dog and see all the intestines with this history. So I did recommend that we keep the pet overnight, NPO, so nothing oral, IV fluids, and re-x-ray in the morning, okay? One, this is a pretty conservative financial option for an owner. And two, this pet was stable and they really didn't want to go to surgery, like really didn't. And I needed to convince them that that really was the next step. I already said that before. If we re-x-ray in the morning and the stomach is still really full, we have to go to surgery. Like there was no other option, okay? So we're gonna do this, we're gonna go NPO. I didn't give Cerenia, I will give Cerenia sometimes if pets are really uncomfortable and actively vomiting. I'll give one dose, I am fine with that. But we did nothing orally, IV fluids, re-x-ray in the morning. And these are x-rays in the morning. So what do you think about these x-rays? You've been on fluids, resting, gave him buprenorphine, or he would like rest quietly overnight. And Sarah Beth had a good question. We do not have 24-hour care at our hospital, and we do not have anybody check on them at night. And what I will tell you is I just let the owners know that that's the case. I tell them that if I'm really worried, I will not keep the pets overnight. But if it is something that I feel like they can wait and they're fine, I will tell them nobody is there, but majority of the time will keep them overnight. And we hospitalize a lot of things. So yes, the stomach is really full still. I did another. See how full that stomach is? Can you see my cursor? If you can see my cursor. Let me see. Put in the chat if you can see my cursor or not. Okay, great. So this is all stomach right here. Do we see that? Full. The PE is actually even more impressive. Way too full, okay? Way, way, way too full. This should not have this much in it after NPO overnight. Things should have moved into the intestines, especially if it's normal ingesta. So this dog needs surgery as the only option for this dog. So we went to surgery. Y'all, I love this video so much. Just let you appreciate it, enjoy it. We decided it was, someone wanted to know what it was. We decided that it was probably a toy. Y'all, it's not even close to being done. Oh, sorry. Touched it. And I have lap sponges there. That, lap sponges, towel. I had pulled extra drape over to put all this material on. And these are sutures, so I can hold the stomach up. Yay! Okay. So that was not going to pass. That was an amazing surgery. I loved it so much. And that was a big old toy in there. And obviously, this was actually ingested at the rescue, okay? This was not ingested with these owners, and they had no clue. This actually turned into kind of a big debacle because the owners financially couldn't afford surgery, and the rescue actually took the dog back and did the surgery, and they told the owners they couldn't keep the dog because they financially couldn't take care of it. So it was a whole thing revolved around this surgery, but this dog did amazing, did great. It was a big gastric foreign body, and it was very, very satisfying. That is a really, really straightforward gastric foreign body, taking x-rays, giving it time. And I will tell you, with a lot of foreign bodies, unless it is an obvious corn cob, even in the ER, probably 85% of our foreign bodies go on fluids, go MPO, and get x-rayed in 12 to 24 hours, depending on their status. If they're comfortable and they're not actively vomiting, I do feel like that is an okay route to go. I do think ultrasounding is certainly helpful. This was cloth, so I'm not sure that they would have been able to differentiate like ingest stuff from cloth. But in medicine has on some bodies exception. So that is where we're at with that one. Okay, and then the question is, there's some questions on here. Let me just look real quick. It's hard for me to read them. The sound is struggling. I'm sorry. I don't know what to do. There's a lot of questions. Okay, so Taylor wants to know, where did you approach for surgery? And I basically did a full incision into the abdomen. The stomach pretty much was sitting there huge, and you just look at the stomach and you have the large part of the stomach that attaches the spleen that has all the vessels on it, and then you have the small part, and you pretty much go in between that and try to avoid as many vessels as you can. And it's just the part that's sitting on top, basically. And it's what you can get exposed in these big, deep-chested dogs, especially when they have a lot in their stomach. If there had been, if there wasn't a financial connection, because I still, on a dog with an unknown history that is stable, I think it's okay to wait and see if it resolves. And some foreign bodies will pass and resolve with fluids, so giving them time is okay. How do you know whether it is an emergency or is okay to wait? Another good question. So definitely, if a dog is really painful when you palpate it, the heart rate is up. If they have any evidence of abdominal effusion, if they're certain that would really shock and surprise me that I would take them to surgery for, or if there's an obvious foreign body. So it's mainly from your physical exam. Also, if they are actively vomiting, I will also do it. If you put them on fluids and they're MPO, and they continuously are vomiting bile, they need to go to surgery usually, because usually that means that there's just nothing moving at all. And I know someone mentioned barium. I really don't use barium that much based on x-rays. It's not something that I use as frequently. So hopefully that helps. If you have more questions, drop them in the chat and my sister can interrupt me. But I'm gonna move on to the next one. So case number 2 is a 15-year-old male neutered to death domestic cat, okay? Straining to defecate, and if you're in cat class, this one for you. Lethargic, not eating. I'm sorry that the sound, it says the sound is going in and out a little bit. I hope you guys can hear me okay. So straining to defecate, lethargic, not eating. 2 previous episodes of constipation, okay? I also, this cat had mild kidney disease and was 15. So what 15-year-old cat doesn't have mild kidney disease? Angry, very obese cat. So tense on abdominal palpation. However, when you are palpating a angry cat, I have a hard time differentiating sometimes pain versus anger towards me. And so very limited exam. Currently, the cat gets Miralax, canned food, and gabapentin for pretty bad arthritis. The owner is unable to do medications significantly on this cat, and they are unable to do fluids or anything like that at home. So what is... Here's something really important, and the reason I put this up. What's something really important to do with a straining to defecate cat that has a history of constipation? If I had to make one recommendation, this is an angry cat, I'm going to get blood on it unless I sedate it. So what is the one thing I could potentially do without it going under sedation to get some information? Jess, do you want to tell me what people are saying? Can you hear me?
Yes. So can you hear me? It looks like people are mostly saying, a couple people have said X-ray, radiographs to look for megacolon, sedation for further examination. Those are kind of the only things that are coming in so far. Recheck
So,
kidney values.
Yes. And I had done that actually recently on this cat. X-ray is definitely the way to go. And this is the reason why. What do you see on this X-ray? The normal treatment for a constipated kitty is going to be deobstipating them.
Yeah, so everyone is saying
deconstipating them and doing enema sometimes, doing.
It seems to be a lot of people are saying megacolon.
I can go look at it.
Lots of gas. Megacolon.
Yes. So, yeah, and you can see like there's a nugget of poop here stuck in the exit, but this is not constipation. This is megacolon, and you do not need to give this cat an enema, okay? And so a lot of people with constipated cats will come in and they'll say, but why do you need to x-ray? You already know the problem. Like, just give them an enema. And this is the reason why I think you should always x-ray a cat that is potentially constipated. I thought I saw Dr. Marshall on here, and I don't know if he has the same feeling as me on there. Are you on here, Dr. Marshall?
I'm here, but I'm on the phone, so I'm gonna have to catch up.
Okay, sorry.
That's okay.
Are you still on the phone? Okay.
Nope, I'm not on the phone now, and I'm all yours now. But I just hung up just like literally like 3 seconds ago.
Okay, well, I was just telling them that this cat had been constipated twice before, and I always x-ray these cats because this is what it has today. So it has like one nugget, but it's not enema. And so like, oh,
You're really choppy for me. I don't know for everybody else, but
sorry.
That's okay.
Let me see. I might be able to move and get better.
Is this x-ray post?
No, this is pre. Hold on. Sorry, guys. Let's adjust.
Now you sound good.
Is that better?
Yeah.
Okay. I'm so sorry. Has it been that way the whole time?
It started to get worse in the last couple of minutes, but I think everyone's saying it's better now.
Okay. I'm so sorry, guys. You just might see more of my family in the back. So, Dr. Marshall, this is actually pre-anything. We took one lateral. This, I'll go to the next screen and show you. This is actually the previous episodes. So here you could see it was definitely significant constipation. But the point I was making was I always will x-ray these because they will sometimes change, and sometimes they do not require an enema. Are you kind of in that camp too?
Yes, dealing with cats mostly. I think we get better, and they're smaller. So, and if they don't mind us messing with them, then we can I often feel what's going on a lot better. But if their bladder's really full, if they're grumpy, that kind of stuff, X-rays really help. Especially like in this one where you'd feel this one and it would probably just feel gassy and really soft and squishy, but you're seeing that big piece of poop in the pelvic canal, which you're not going to be able to feel by palpating their belly. But that's a lot of gas.
Yeah, and he was actually, he was angry, and he's one of the fattest cats I have. So I really can't usually palpate much on him because he's just so tense and fat. So I X-rayed this one because he did not need me to do an enema on him. I was actually able to manually remove this piece of poop here. We got some sub-Q fluids in him, and the owner elected to take him home. But he actually continued to have episodes, and the owner just couldn't do much with him at home. And so we had to put him to sleep actually 2 weeks ago. But the point I was making was I would try to X-ray these if you can, because this was previously, and there is a difference, okay?
Oh, yeah.
So these will change over time. And I think it is a explanation to the owner, especially when you can't palpate or can't feel them, that it's important to know that before you're shoving an enema in them.
For me, doing X-rays over time like that too, it really helps with me with the consistency, just how dense the poop is, because you can tell if you're using the same settings, even if it's really, really big, if it's pretty moist and fluid filled, or if it's just really, really dry and desiccated. X-rays help me with that too.
Yeah, and this poor guy, I mean, he was having these parts just hanging out of him, and I had to sedate him to try to do anything with him, and he was just a interesting case. But I'm trying to go over the communication with these cases of the big thing for me is what is the goal? And the goal with this owner was to try to keep him comfortable, but we were definitely limited financially and also with what the owner was able to do with this pet at home. And there's a lot of recommendations you can make, but if we're not having success and we're having this amount of episodes this close together and they're not able to do increased like fluid intake at home, I think I kind of start setting them up for, this is going to be something eventually we're going to have to say, we're going to have to stop because this poor cat is so uncomfortable and is having such issues. There was some
Tanasia, yeah, there's a question that someone asked, if this wasn't a younger cat and not angry, what would be the treatment in that case? Would it be the same or would the treatment be different?
So I think that you could, like I removed this poop piece on this cat and then it was just a lot of fluidy diarrhea, and this cat definitely has a megacolon. You can do things with diet for megacolon. Ultimately, there's also surgery that you can do for megacolon, but it's not, in my hands, not a great prognosis long-term. And so for a younger cat, it would be having a discussion about food and about options. And I have had 2 clients do surgery and actually the cats did really well. What about you, Dr. Marshall? What do you think about younger cat?
I'm not really even sure in my 30 years that I can say I believe in the diagnosis of megacolon in cats that much. I think that as like this cat that has been chronic for so long and it gets really, really stretched out and there's bad tone there, that's one thing. And because I've had them where if we work hard enough with them, we get it soft enough for long enough, everything comes right back down. Yeah, okay. Eventually, and hold them that way. So as far as a anatomical defect in the muscle for these to call it megacolon, I don't know that I buy that. Does it mean that there's not serious ones that need either euthanasia, need surgery to be able to be a treatment option because the alternative is not going to happen over time because you can't give enough enemas, you can't anesthetize them enough, those kinds of things. Yes, but as far as specific diagnosis to say from either x-rays or palpating time that this is megacolon, I'm not convinced yet.
Okay. No, that's good to know. I mean, most of mine that are this bad are cats that we're unable to do much with and the owners are unable to do much with. I agree that there is a lot of options if the owners can do more at home, and the cats are amenable to it. So, and in the hospital too.
Yeah.
Okay. Not fun. So this was my point though. What are the client's goals? You have to balance the finances with the options, and you have to be really realistic with these owners. And I think anyone who has a pet that they can't medicate at home at all, and I hear that all the time. One, I do think you have to have a realistic conversation with people, because a lot of owners will say, well, I can't give them anything. Like I can't medicate them. But there's so many things out there with compounding medications into treats, into liquids. There's so many foods that prescription wise can really treat a lot of different conditions. And so you really have to identify, is it the owner is not willing to try different things and they just won't do it because of finances or because of time or because of lifestyle, or is it they really, really, truly can't get anything in this pet? And I think it's uncommon that you really, truly have a pet that you can't do something for in some way. But you definitely need to have a good compounding pharmacy you have a relationship with, because I've had pets that you can't get a liquid in, but you can get a flavored tablet in. I've had pets that you can get a capsule in where they actually take the medication and they put it in a capsule and it can be slipped down the throat easier. I've had it where they make it into a liquid that's so flavorful you can put it on food and the pets will eat it. So you have to kind of play with stuff. But if you have owners that are willing to work with you, there are a lot of options for treatment out there. But finances are part of it too. And something that has been diagnosed with a chronic condition, it is definitely a discussion about what it entails going forward. And I always try to set them up for all the possibilities, because the sooner you start telling somebody, okay, this is something that you're going to have to deal with for a long time. These are what will happen. Best case scenario is this. Worst case scenario is this. It's going to set you up more for success as you're going along and you're talking to these clients and you're trying to help them and you're trying to help this pet as much as you can. Okay, case number 3 is a 7-year-old domestic short hair female spayed cat. The reason I know she's spayed is because she was a rescue and I opened her up to see if she was spayed, and she was. So this is like one of my first that happened on, but she had like no scar. So she had to been done when she was like itty bitty bitty. She is 7 and this owner's had her for 6 years, but she is inappropriately urinating. She actually urinated on the owner's bed, and they noticed that it was pink tinged, and they felt like there was probably blood in there. Otherwise, eating and drinking, acting completely normal. She's a little chunky, abdomen palpates normal, and I couldn't really feel a bladder on her. I felt like it was probably pretty empty, because cats that are urinating inappropriately, oftentimes there's some component of cystitis there and they're emptying their bladder really, really frequently. So what is your next step? What do you need to do? And we'll see what you guys are coming up with.
Looks like over.
Yes.
Yeah.
This is definitely going to be. Is that what they're saying? Yes. Okay.
Yes, your analysis.
So my differentials in a cat for bloody urine are definitely going to be UTI, feline idiopathic cystitis, whatever you want to call it right these days, or something like a bladder stone or even bladder tumors. So what I like to do, and it's like a trick, I guess, but I like to get my urine with an ultrasound, because I can see a lot with an ultrasound. I can look at bladder wall thickness. I can look and see a lot of times if there's an obvious stone. I can see if the bladder's small, if the bladder's big. So we use ultrasounds. We actually have technicians that are trained to get the samples. And I think it's really important to get a cysto sample in case you need to send it out for a culture. So we have built into our urinalysis an ultrasound for cysto cost, and that actually also is, a business decision that works really well for us. We get more information, and we actually feel like we're being more thorough. So this is this cat's ultrasound, and this is just going to be a screenshot of it. what do you see on this ultrasound? And it's kind of hard because it's a like single shot, but it was obvious enough that my techs were like, Dr. Crocker, can you come take a look at this, please? You can see all of us like in the picture too. So what is everyone saying?
Looks like everyone is saying a stone down there, a thick wall. Looks like there's some shadowing happening.
So both those things are correct. Yes, this is the wall of the bladder. So see this here? That's a pretty thick wall. And then this right here is a bladder stone. And the reason you can tell is because it's got shadowing. So see how it looks black there? So if it's not something that has anything that the ultrasound will bounce off of, the waves, so if it's normal tissue, it'll just penetrate through it. But when it bounces back at you because it hits something that is more dense, you get this shadow effect here. So this is a definitive bladder stone, and this is shadowing. This is a female cat, okay? So the next question is treatment options. Now, there's two different ones. For medical management of these, I usually only recommend medical management if finances are a concern or in female cats. I have pretty good success in medical management of these in female cats, depending on owner compliance and cat. This cat's great and amazing, and you can pretty much do anything you want to with her. So medical management wise, what would be your thoughts? Diet. Dr. Soph is in there. Urine sediment, yes, Mariah, 100%. We did do a urinalysis. I'm sorry, I should have said that. There was a lot of blood, so it was actually hard to see much else in there, but we did see struvite crystals in there. And that was the only type of crystal that we saw. So diet, wet food. Crystals don't always respond to stone type. You are correct. But sometimes they do. And if you can dissolve it without doing surgery, is it worth it? Sarah wants to know how often do you send them out? Every time I do a bladder stone removal surgery, I try to send it out. I would say 95% of the time. So you guys have a lot of good ideas. I will usually do diet change, and SO is usually my number one, but there's a couple different ones that you can try. Antibiotics if needed. So culturing this would be ideal, but I do think a lot of times if you have a lot of blood and irritation in a bladder and it's suddenly worse, I have found that 5-7 days of like an amoxicillin or a Clavamox do quiet these bladders down and make these cats more comfortable while you're trying to dissolve the stone. And so we'll do sometimes pulse antibiotics, like every 3 weeks, we'll do a 5-day course while we're trying to dissolve the stone. Pain medication, I'll usually do some gabapentin if they're really inflamed and irritated. I don't find that many anti-inflammatories in dogs or cats make a huge difference in bladder cystitis, but I do think GABA just always makes a cat feel better. And then recheck x-rays in 30 to 45 days. And that's usually sufficient. And I've had dogs and cats that have had stones dissolve in 30 to 45 days. It's amazing. And the big things you discuss with the owners are they staying comfortable? Are you okay with the fact they might still have inappropriate urination on and off? If it's a male cat, I usually don't recommend it because I don't want them to get blocked, but females can often dissolve these and they can eventually pass them. So surgery is what we do if they do block or if they're not comfortable. And I have had 2 female cats that have blocked and I've had to do surgery on. Surgical management would be a cystotomy. It's one of my favorite surgeries. We did take an x-ray, and this is the stone on x-ray. So pretty much just one, it's fairly small. And to me, we have a good chance of treating this cat. So this was actually a week ago that I saw this cat, and she has been on diet, antibiotics, and GABA, and the owner says she's doing great. She's comfortable, she's eating diet, she's eating the food. We are going to re-x-ray her in a couple weeks, but I feel pretty comfortable that she will resolve with medical management. Any questions on that one? Oh, Dr. Marshall said 2 to 3 weeks. I love it. Okay, Nicole wants to know, would your first choice be surgery? So not in a female. In a male, yes, I'm usually always in my males recommending doing surgery, but in a female, no. A majority of my females with bladder stones, they can resolve with medical management, especially cats. I feel like most of them are amendable to diet change. Okay, so any other questions?
Someone asked, would you always do ultrasound first or start with Rads for diagnostics?
That's a good question. I always do ultrasound first with a urinary issue because you can often see the stones or just a lot of sediment or swirling with the ultrasound more than you can with the x-rays. Remember, ultrasound is going to be better at seeing the inside of an organ or of an area. So even here, I can't tell bladder wall thickness on an x-ray. Okay, I can't even see a bladder wall tumor on an x-ray. All I can see is that one little stone. So if this is just a basic urinary tract infection or a cancerous mass, I'm not going to see that. And even if it's a lot of crystals maybe or hematoma in there, I'm usually not going to see that. So x-ray is really limited in my hands for urinary issues. I think ultrasound is the way to go. And I actually like and have done extra training on ultrasound, so I really, really enjoy that.
Sarah wants to know, how do you talk about the potential for a blocked cat when there is a multi-cat household? What clues could you tell them to look for, like lethargy, dull, mentation, crying out? You can tell I'm not the vet here, right? As far as that goes. So if there's multiple cats, and so they know which one's urinating and which one's not.
So that is a tough one. And what I will often do is short term, I will sometimes have people like separate cats in litter boxes just to see if one cat seems to be going like more frequently in smaller amounts in a certain litter box. I actually had an owner last week that brought 3 cats in at the same time, and we got urine samples on all 3 because we didn't know which one was having the issue. And we did 3 urine analysis, and we found the one that had the crazy rods and needed the treatment. So a lot of times people will pick the one they think it is and we'll check urine, and if it's normal, we'll go through the group. But you either have to separate them or you have to test all the pets. And it can get really tricky. And I think it's the same thing with diet change. It is hard sometimes to change diet when you have multiple pets. And I will often, if the owners are okay with it, I will just change everything to the diet that I need the one pet to be on, if possible. SO is not going to hurt a cat that is eating it that doesn't have a stone. And so we'll do that for a while to dissolve the stone. And then a lot of times I'll switch cats to something else long term. And then I saw, why do you want to do an x-ray? Or okay, so I would recheck with an x-ray because you can see the size of the stone right now, and I can do a much better comparison to see if the stone is gone or not on x-ray. Again, I could ultrasound, but if it's really small, it might be harder to catch on the ultrasound if it's hidden in the folds of the bladder, but it's pretty definitive if I take an x-ray and I see this stone now and then I take it again, or if there's one still left a little bit, I can do a size comparison and measure it. So I will always recheck with a radiograph when I'm specifically looking at the stone, because I can see the stone so well on the x-ray and I can measure it.
Okay, there was another question that said, would you do any anti-inflammatories to take care of the thickened wall?
So Dr. Marshall might want to weigh in on this too if he is on here still. Yes, he is. He might be busy though. Again, I will give anti-inflammatories, but my understanding is anti-inflammatories don't penetrate the bladder really well. That's why a lot of times if you have an issue with the bladder, I often don't do anti-inflammatories. There's something about the receptors, and y'all, I'm sorry, but I don't really know how it all works. But I don't often do an anti-inflammatory with urinary issues. I feel like the antibiotics penetrate really, really well, and usually antibiotic and diet alone take care of it. So I don't. and I haven't had to. Post-op, when I've done surgery on them, like a cystotomy, I will often send cats home on like Onsior or something short-term, but I don't usually do it otherwise. Again, I'm trying to also weigh how many medications I need to give this pet and how many things I need to try and change with this pet. And so that's not as high on my list.
Okay. Miriam asked, would using some medication to alter urine pH depending on type of crystals would help? Would that help?
So I would say no. A lot of times the diet will alter the pH depending on diets you pick, but these diets are based on dissolution. And so they're just drinking and peeing more, and that's getting rid of the crystals. The pH will change with certain diets, but not with the SO. So instead of adding a medication, usually the diet is acting as the medication, if that makes sense. And that's why it's really important to explain to people they need the prescription diets that have been formulated specifically for this, and not just some random urinary diet off the shelf and off the counter. I know Sydney asked about Serenia. I love Serenia, and yes, it helps with visceral pain, and I will give it to a lot of my post-op cystotomy cats. I don't know if this is going to kick us off time-wise, because we're almost at an hour. So let me just run through real quick. I have added some other scenarios that I've dealt with just this week that are what would you do scenarios. And I also have added websites that I think all of you need to know that would be good resources for you. And these PowerPoints are going to go up on my, my website. And so if you want to go to that, you actually will be able to download this PowerPoint and have this information. And you just go to www.drcrockerpetvet.com, and there's now a tab at the top that says resources, and you can go, and this entire PowerPoint will be on there. So you guys can get it, and you can kind of go over everything. And there's also a PDF on there now for sutures. Dr. Soph made it for me, and she's amazing, and she did such a good job. So I really want to make sure you guys go and take advantage of those things. You can have the PowerPoint, the PDF is up there now. And if you go to that today, you can also make sure that you're signed up for the emails so that you can follow these other classes. Now, if they're not going to kick us off as of now, we can go over these other situations if you guys have time, or if anybody wants to. I don't know if you, I can just run through maybe what I did in these circumstances, then you guys can ask me questions. So, client threatens euthanasia due to financial constraints. This is a client that has long been a little emotionally manipulative, and I understand and I'm used to it, and I know how to deal with him. And so he said, if I have to bring this dog in and I have to do any testing, I'm just going to put him to sleep. Okay, this is an aged lab who has mastiticatory myositis, and he also occasionally gets diarrhea because the owner likes to change food on him. He likes to change medication on him. He gives him his medication for pain. It's a difficult situation. But I've had other clients do this too, where they say, well, if I have to do testing, I'm just going to put him to sleep. Well, if I have to do this, I'm just going to put him to sleep. And it's not that they're saying you're just in it for the money. They're just, it's almost like a backhanded manipulative thing. And so here is what I do to handle these situations. I pause for a long time. I don't say anything. And then I say, I'm not really sure how to respond to that. I mean, it is up to you if you want to put your pet to sleep. I don't feel like we are at that point. I think there's some things we can try, but I can't guess, and I don't have a crystal ball on what's going on. So I do need to do more tests if we're going to figure this out. What do you think? And I think the pausing and the calling them on it a little bit is important, but I also think, and this is really, really big for you guys, it's hard to say, but you can't care more than the owner does sometimes, because you are going to emotionally get lost in the cases. And so I've done a lot for this dog. I've taken care of this dog for years and years and years and years. If this owner won't take care of him anymore when I know he has a chronic condition, maybe it would be better if this pet was put to sleep, okay? But I can't take that on myself. all I can do is kind of call the owner on it and put the ball back in their court. But what he's trying to do is put off on you that it's your fault if this happens. And all you can do is say, no, really, this is on you. And if you want to make that decision, that's your decision to make, but here's what I think. But I do think it is okay to say to a client, I'm really surprised you said that, or I don't really know what to say to that, if they say something really shocking like that. I think it's really, really, really important. So what do you guys think? Are there any questions about that? And again, these are like really straightforward scenarios and things that have happened to me just this last week. Sarah Beth said, it is an owner's decision. The silence part is helpful. Yes, the silence part is huge. And even repeating it back to them, like Katie said that, saying, okay, so what you're telling me is instead of doing a urinalysis, which cost $60, you want to put him to sleep. Like, I think it's very important to kind of relay back what they're saying to you, and kind of question it and leave it hanging there and have them thinking, because what the clients are wanting you to do is say, well, okay, I'll do this, or, oh, I'll just do medication, or, oh, da, da, da. And what they're trying to get you to kind of start fumbling and start trying to make it work for them. And this is not on you, okay? You're not taking this on. This is them, and you are letting them work it out, and you are just there. Clarissa wants to know, what if the owner insists to put the pet down? This dog has a lot of medical issues, and if he decides to put the pet down, I mean, it is his pet eventually, like essentially, and you would have to put the pet to sleep. If you paid for every test, diagnostic, and treatment on a pet that an owner couldn't afford it, you're going to be out of business. You cannot afford to do that. And if an owner can't take care of a pet, unfortunately, you have to sometimes make that decision. Dr. Marshall, do you have more of these confrontations more in the ER than GP? Yes, I would say yes. In the ER, the hard thing is you don't have the relationship that you have in GP a lot of times. And a lot of times finances are more of an issue, and everything costs significantly more in the ER. So I was actually going to do a talk all on discussing finances in general practice and in the ER with more of these scenarios. So if you guys would like me to go over that and do that talk, definitely give me a thumbs up yes, because I think especially in the coming months, this is going to become more and more and more of an issue for people. And we're already seeing it in the ER and having to do more euthanasias due to it. So maybe that'll be my talk next week. We'll be discussing finances, because I think it's going to be really important for you guys. And we're still navigating what's going on too in the world. So, okay. The other one, I'm going to skip the heart prevention one. Basically, it was our bad, and I apologized to the owner. And I personally did it because I don't think it's something a staff member needs to do. And we know Charge gave them up-to-date heart prevention. So again, identifying what you did wrong and you being the one to reach out to an owner, I think is really, really important sometimes as a veterinarian. Now this one, the angry client wants to be in the building for euthanasia. This was a client that actually, this happened yesterday, physically pushed their way into our building in the ER because they wanted to be with their dog for euthanasia. And then when we pushed them back out of the building, they stood outside the door and wouldn't give the staff any room to go in and out of the door. And so eventually we got them moved farther away. But what we had to do was have several conversations with this client explaining to them our protocols. And eventually we had to tell them, if you will not listen to our protocols and you will not respect what we're saying and that we're trying to keep our staff safe and help you and your pet, we are going to bring your pet back to you and you can take your pet elsewhere to be euthanized. You cannot let a client dictate what you do. You have to protect yourself. And this is not just with what's going on with the COVID situation, even though that is very, very important. In general, in practice, okay? You have to protect yourself, you have to have boundaries, and you have to be okay with saying no. And this was one person. They were also upset that they couldn't say goodbye. So we said we would bring the pet back out, put it on the grass. We'd walk away, they could say goodbye to the pet, we'd go get it. And they were very angry that we wouldn't let them just come in and say goodbye. They didn't understand. Eventually we got them to agree. We went outside and then they stood there and tried to all rush over to us, and we had to yell at them and tell them that they needed to back away. And it was a pretty interesting, difficult situation. And so you have to, one, have the authority. You have to be working somewhere where you have the authority to make decisions to keep yourself safe and keep your staff safe and to set boundaries that work for you and your staff. And two, you have to, even though this pet needed to be put to sleep and it needed to be taken care of, sometimes you just have to say, I'm sorry, but you're not behaving yourself. You're not okay. I'm not helping you. And do not get emotionally manipulated into doing things that you are not comfortable with and that are not safe for you and your staff. I did put this dog to sleep. I then called them. They thanked me. We had a discussion. I said, I know things were really emotional earlier, but we told him he was a good boy and we loved on him. And we were there with him when he passed. And she said, thank you. And it was very strange. So I do think that being strong in your boundaries, being empowered by your bosses to say no and keep you and your staff straight is really, really important right now. So that was just one that just happened. And I wanted to share it with you guys because again, it was kind of interesting. I am going to be done on that point, and I'm not trying to leave you on a downward thing. I think that for the most part, again, things are going well with all this craziness that we have going on in practice, and most people are very thankful that we were just open and we were taking care of their pets. And so I don't want to scare you. A lot of people are just really grateful that we're available. And even if they can't be with their pets, I still think it can be a good time to be a veterinarian, even though it is a hard time. And I think we're getting recognized as being essential in helping people, and that pets are such a part of the family. I think that is really important. So let's hold on to that good. Let's hold on to the fact that we can all gather, even if it's electronically, and talk a little bit. If you have any specific questions, you can DM me, you can email me. Again, here's the slide with all the other resources that you should definitely be a part of. And I hope that you got something out of it. It wasn't a ton of medical knowledge, I guess, but the big thing was kind of giving you some of those tidbits that have helped me with communicating. And I do think those things are really important. I think that's it. You guys have a good day, and I'm glad you enjoyed it. And make sure you go to my website. You get the resources, you get the PowerPoint, you get the PDF. Thanks, Sophia, so much for doing the PDF for me. You're amazing. And I hope you guys have a great day. I wanted to take a picture of everybody, but
they are asking when your next class is. So just to confirm, your next class is next Friday at the same time, possibly?
It will probably be next Friday. Sorry, I'm going back to the book because y'all wanted to see the book. It might be Thursday. I don't know if Thursday would work, but it kind of depends right now on my schedule, because schedules have been a little all over the board with everything going on. I've been helping out a little bit more at the ER. So would Thursday work for y'all, or is Friday, oh, it says internet is a little messed up. Would Thursday work for y'all, or is Friday the best day still? Can you guys vote on that and tell me? I'm so thankful for all of y'all coming. Friday's better, either.
Kind of in the middle there. Either, whatever's best for you. Well,
What
it is
to do,
recorded
so
also, which is nice, right? You're recording it, so that means that you can also share the content and the PowerPoint later on.
Yes. So on the, I could do a poll. Yes, a poll on Instagram. On my website, I have videos up, and I actually have last episode of Extra Credit with Dr. Crocker up. And so you can actually get that video too, because we talked about a lot of stuff and we did a case at the end of that. So thank y'all for hanging on so long. I really, really appreciate everybody. Y'all are amazing, and I hope you have a good day. Bye.